Now we start scanning pelvis of young male by using linear probe by placing in transverse position at suprapubic area. Here we see the urinary bladder. The urinary bladder is almost filled. Now we're sliding probe upward to locate the distal ileum or distal part of small intestine. Here we see the peristalsis in the gut. The distal ileum is full with food particles and shows increased peristalsis. Now we slowly sliding the probe to the right iliac fossa to locate the ileocecal junction and cecum. Here we see the distal ileum is mildly prominent and gases are absent. Here we see the tubular echogenic structure in the distal ileum, which are large in numbers. These are multiple worms or ascaris which are present in the distal ileum. Remember that worms are also causes lower abdominal pain or bilateral abdominal pain. Mostly this pain started at evening time. The wall of distal ileum are normal and are not seen. Now we continue sliding to the right iliac region. Now at right iliac region we see two lumen which are lies parallel to each other. The surrounding tissue of these two lumens are echogenic and edematous or inflamed. Now in two lumens we will appreciate the part of distal ileum and appendix. This lumen is distal part of the ileum and it continues to join with the cecum. The walls of this part of ileum are inflamed. The hypoechoic wall is muscular layer and hyperechoic layer is submucosal layer. Now we will rotate the probe at its axis to locate the appendix. The appendix is crossing the posterior wall of the distal ileum and attached with the cecum. In appendix, we see the central hypoechic area, but in distal ileum, it is contracted and with absent peristalsis due to inflammation. The part of distal ileum at ileocecal junction is inflamed, but the other part is appears to be normal, mildly prominent with absent gases. Now we slowly rotating the probe to find out the blind end of the appendix. This is blind end of the appendix. The appendix is covered by echogenic soft tissues which are inflamed. No peripendicular collection or fluid seen. Now we're rotating the probe at its axis to get the cross-section view of the appendix, and we will measure the anterior posterior diameter of appendix. The anterior posterior diameter of appendix is 8.5 millimeter. The normal diameter of appendix is up to 6 millimeter. This is cecum, which is full with gases, and the walls are mildly inflamed. Now we continue scanning the proximal part of ascending colon, which is also normal and full with gases. No free fluid seen in the right iliac region. Now how we will write report.